Folks, because, sometimes politics kind of lives up here. It's not. It's on the ground. It's people's lives right now. This situation today and this speech from the throne is different than any other. This is governments that are supporting businesses, and people's lives are on the line here. This is not an overstatement to say. So let's talk about what we need to see today and how this speech has to connect to reality and make a difference now, not just a political promise that blows away in the autumn winds here. Political commentator Scott Reid joins us, former senior advisor and communication director for Prime Minister Paul Martin. Semhar Tekesti is a conservative strategist who worked for the Conservatives in both opposition and in government. Paul Taylor is a former NDP candidate and executive director of Food Share Toronto, a lifelong anti-poverty activist. And CTV's infectious disease specialist, Dr. Abdu Sharkaway. Great to have all of you here. A very, very big day. I think maybe the most important speech on the throne I can remember. But I want to start on the medical side before we get to the political side, Dr. Sharkaway. You just heard what Krista was saying. The testing center issue is a nightmare. Can that be fixed? And is that you're a doctor, you understand triage. Is that the priority right now?
Well, there's no question about it. Right now, there's just a massive void that is filled with anxiety and uncertainty and apprehension. And that's not what we need now when we are fully thrust into the second wave. We need some degree of certainty in terms of knowing what the actual extent of this virus is in our communities. And we need a safe protocol for allowing people to work. Including healthcare staff, including frontline workers, people who work in long-term care facilities, and for as long as we can keep our kids in school and others going to work, everyone else. And having people wait for hours at a time for a test that's going to take several days for a turnaround with a result is simply not tenable. So I would want to echo what Premier Ford said earlier. We need as much support as possible by Health Canada to expedite rapid tests that are accessible to people in locations everywhere. And until we do that, this just is not going to get any better.
You said something today on Twitter, and I want to just run it by you because I think, there's so much, it's politically difficult to tell people to go back to new restrictions, but you say we have a collective fail, that we've all dropped the ball. So this is not a political statement, it's just a collective statement. Hasty loosening of restrictions, you write, letting our guard down, schools filled to unsafe capacity, you write, no practicable rapid testing. You say new lockdowns are unavoidable now. Why do you say that?
The way the numbers are trending at this point, it just seems implausible that we'll be able to carry on and just say, let's do better. It's not going to work. We're going to have to take some serious action in terms of restricting public gatherings, in terms of restricting places like indoor dining and bars that are simply not a priority at this point in time. Now, I will mention that caveat has to be that there has to be some form of financial support and relief for small business owners. We can't make the same mistake we made in the first lockdown and suggest we're all going to get through this fine. We do have to make sure that we're helping out those who are going to suffer from the economic losses, but we can't go on with business as usual. The message clearly is not getting through to enough Canadians, especially in Ontario and Quebec.
All right, Dr. Sharkaway, I appreciate that.